Germany, 1954. A country rebuilding from the ashes of war. Factories, once used to make weapons, were now producing things like cosmetics, chemicals, and even pills. In the small city of Stolberg, a pharmaceutical company by the name of Chemie Grunenthal had just released its first major product, an antibiotic. But they wanted more profit, more reach, and more power. And in the laboratory buried beneath corporate ambition, they found something new, a chemical compound called thalidomide. It was never supposed to be a miracle. In fact, it was originally developed as a potential treatment for seizures, but it didn't work. What it did do, however, was knock people out, quickly, cheaply, and without making them feel addicted or foggy. Now, to executives, that was enough. A sleeping pill, easy to market, and easy to sell. So in 1957, the drug was branded as Contergan and it was released into West Germany. It didn't require a prescription and it was marketed to housewives. It was also sold as completely safe. No toxicity, no overdose risk, and no testing on pregnant women. By 1958, thalidomide was being pushed not just for sleep, but for morning sickness, making pregnant women the prime market. And it spread fast. The UK, Canada, Australia, Italy, over 46 countries approved it and started to distribute it under various names, each one promising the same exact thing, relief. But in the United States, someone said no. Dr. Francis Oldham Kelsey, a medical officer at the U.S. Food and Drug Administration. He refused to approve thalidomide for sale because the data he was looking over did not look right to him. The company pushing it, William S. Merrill, could not prove that it was safe. She was pressured, mocked, even told that she was just being difficult, but she held the line. And because of her, thalidomide was never sold in the US. Not legally, however. But by then, it was already too late for the rest of the world. What they gave the mothers was nothing compared to what they took from the babies. They started calling them flipper babies. Not in hospitals, and not in research papers, but in the streets. That was the name whispered by strangers when mothers tried to take their children outside when they dared to be seen. But they weren't flippers, they were children. And they had no arms, no legs, no ears, and unfortunately no chance right at the start of their life. The drug attacked while they were still forming in the womb. Thalidomide interferes with blood vessel growth, disrupts limb buds, and prevents tissue from reaching the outer body. The result? Phocomelia, a condition where arms and legs are shortened or completely missing altogether. Some babies were born with hands attached to their shoulders. Some had no arms at all, just fingerless stubs. Others had no legs, or a single twisted foot where their hip should be. Some were born without ears, without eyes, with deformed spines, with missing organs, you name it. By the time doctors had realized what was happening, though, it was already an epidemic. More than 10,000 children across 46 different countries. Some survived, but many didn't. In Australia, they noticed it first. One maternity ward reported 24 limb deformities in a single year, up from 0. In Japan, some mothers were told that they were cursed, and in Britain, they were told nothing at all. Doctors simply labeled it as a tragic coincidence. But behind the hospital doors, it was way worse. Some babies were taken from their mothers altogether, immediately and without explanation. Some doctors believed it was more humane to let them die quietly. The mothers were blamed, accused of alcohol abuse, bad genetics, and bad parenting. Some were told to forget, and some tried, but others didn't. Monique Robbins, born in New Zealand in 1962, had no arms and one leg. Her mother had taken thalidomide for 2 weeks. Monique would go on to live, grow, and speak, but the world never stopped seeing what she was missing. Some survivors became activists, others lived in complete silence, and some still don't even know why they were just born differently, because no one ever told them. And even for those who survived, the cost never stopped. Prosthetics, surgeries, isolation, abuse. Many couldn't go to school, couldn't even eat without help, couldn't walk down the street without hearing the word monster. And through this all, the companies stayed completely silent, and so did the government. The silence was louder than the screams. What they did was completely unforgivable, and what they didn't do was probably even worse. By the early 1960s, they knew. The Grunenthal company had received dozens of letters from doctors, mothers, and even other hospitals, all saying the same thing. something is wrong with the babies. But instead of stopping production, they doubled down. They claimed that there was no evidence and that the defects were just genetic and that it was all just a coincidence. They launched public relation campaigns, paid for studies that showed nothing, and even told doctors to keep prescribing it. And all the while, the babies kept coming. It wasn't until 1961, 4 years after the drug hit shelves, that a German doctor named Wittgenstein Linz found the pattern. He published his findings, spoke out publicly, and called for an immediate ban. Only then did the company begin to pull the drug. But it wasn't fast, it wasn't honest, and it wasn't over. They delayed recalls, downplayed risks, and blamed everyone else but themselves. In some countries, thalidomide stayed on shelves for another year. By the late 1960s, the lawsuits started. In 1970, the Grunenthal Company's executives were finally put on trial. They were charged with negligent homicide and intentional injury. It was supposed to be a reckoning, but it wasn't. Not a single executive served prison time. The trial was quietly closed, the records sealed, and the company issued this statement. We regret the tragedy, but we are not responsible. That's it. Instead of prison, they paid a settlement. Millions were paid to victims in Germany, only if they signed away their right to sue. In the UK, parents were forced to sign NDAs, non-disclosure agreements. In Canada, lawsuits dragged on for decades. Many families never even saw a dollar, and many survivors still haven't. To this day, the Grunenthal Company remains operational. They never admitted the guilt and never accepted any responsibility whatsoever. They call it a tragedy, a mistake, an unfortunate accident. But it wasn't an accident. It was neglect. And the world let them walk away, completely unscathed. It's not just history. It's still happening, just under a different name. Thalidomide was never supposed to survive, but unfortunately it did. After all the damage, after all the broken children, it's still on the market today. Not for sleep, not for morning sickness, but for cancer and leprosy. It's now sold under strict regulation. Every box carries a pregnancy warning, every dose is logged, and every patient is tracked. But the irony is sickening. The drug that mutilated thousands is now being used to save lives, and yet the survivors still live with what it took from them. Many of them never received full compensation. Some still struggle to access care. Others were forgotten entirely. In countries like Spain, Italy, and Canada, victims have spent decades fighting in courts. Some died before anyone even said the word sorry. And the pharmaceutical industry? Today, it's larger and richer than ever. New drugs are tested, approved, marketed, and pushed out, sometimes without long-term studies, sometimes before they are even fully understood. The lesson of thalidomide is supposed to be the warning, but warnings fade, and people forget. History doesn't always repeat itself. Sometimes it evolves, gets cleaner, faster, and smarter. But underneath the bright lights, there are still those shadows, and behind every pill, there is still that risk. The next thalidomide might already be out there. Hello everyone. If you made it to the end, as always I just want to say thank you guys so much for watching. These stories take a bit of time to make, so watching all the way to the end really means a lot to me. If you enjoyed today's topic or found it disturbing in any way, please like, leave a comment, and if you're new around here, maybe even consider subscribing. We post new videos every Tuesday and Fridays around 6 or 7 EST. With that being said, thanks again for watching, and I'll see you next time.